Today I'm going to talk about two ingredients that most products have which should never be used when it comes to any of the scalp infections, whether it's a simple dandruff or scalp psoriasis, seborrheic dermatitis, or tinea capititis, which is a fungal infection of the scalp. Any of the scalp infections, never use these two ingredients. Today Jyovis is in 50 plus countries. We see patients across the globe for a condition, they are again and again prescribed the same kind of an application with of course different brands. Patients come to Ayurveda after 10 years of time and they experience the problem is as it is, along with more issues, more complaints and a lot of other issues. So today in this video we're going to talk about these two ingredients and we're going to tell you why you must never use it and what you must do if you are looking for a permanent cure with a problem solution with no reoccurrence, no relapse seen. So watch till the end. Let's understand about scalp infections in this particular video. Namaste everyone, welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. We're talking about scalp infections. Now, whether it is about a simple condition which is dandruff, explained as darunak in Ayurveda, whether it is world's #1 disease, scalp psoriasis, which as per statistics, more than 60% of the people have it first over the scalp. Once ignored, once suppressed, once the time is gone or suppressed inside the skin, we experience the lesions coming across the body. Every patient, today we see world's #1 condition. The world knows, the patients are told there is no cure, nothing can be done. We see through Ayurveda how patients are permanently cured with no relapse. We see when we ask the patients how did this occur, they always have the history of scalp infection. They always tell us that earlier I had the dandruff but never knew that this could be a scalp psoriasis and I would have patches all over my body today. So whether it is scalp psoriasis or a form of eczema which is seborrheic dermatitis, whether it is a form of fungal infection which is tinea capititis, or whether it is this combination of fungi and yeast which is called as malassezia, which is a very common type of an infection. Any kind of a scalp infection, as the patient is looked at, they're prescribed these two kinds of an ingredients, and after years and years of condition, we see problem coming back along with other issues which we're going to discuss in a couple of moments today. So let's understand these two ingredients, very important. Coming to the #1, this is Ketoconazole. Focus on the ingredient, not the product, whether it is Keto A, Keto B, Keto C, thousands of brands across the globe. Across the globe, we see patients using this one ingredient coming across the advertise, some brochures, some videos and some here and there information. It is said Ketoconazole, magical ingredient. Of course, magic. Graying is like the side effect of Ketoconazole. Now, focus on the word Ketoconazole, azole, A-Z-O-L-E or Z-O-L-E. You'll find miconazole, fluconazole, luliconazole. You'll find a number of zoles which are the antifungal ingredients. They will just suppress the infection. They will just suppress the infection inside the skin, giving you temporary relief. Within one wash you'll experience, whether it's a lotion or a shampoo, one wash everything is just gone. Use a Ketoconazole, one wash, it's pretty clear, it's good. But within 3 to 4 days or a week or two, everything just comes back as it is. Patient likes it, sees the result, years and years of using, comes back to graying, comes back to baldness, comes back to severe scalp infections. We see if the problem is suppressed, it is going to come back again. We don't need suppression, we need a cure which comes from within. So that's about Ketoconazole. Definitely you must have used it, so make a note of this. And if you have a scalp infections that coming back again, then make sure you never use this. Coming to the #1, it is called as the Betasol. Betasol, whether it's Betasol or a Betasol, a magical ingredient for any scalp infection anywhere over the body, anywhere over your fingers, your body, anywhere over the scalp. Apply this and you see magic within 1 day. Everything just vanishes. But the important part is that it is definitely going to come back. Of course, again I repeat, over the epidermal layer, superficial layer, it just vanishes, and which is why only 1% people get the benefit from these medications. Rest, everybody suppressed, coming back again. So this is a group of corticosteroids. A topical corticosteroid has magical result when it comes to scalp infections or skin infections overall. When we examine it, we tell them that this is psoriasis. First, the infection has to be clear. It is very important to know that patients complain of hair fall or baldness or new growth is something they want, but they also complain that I have dandruff. When we examine them, it is very important to examine, and yes, we tell them that this is not dandruff, this is a scalp infection which needs to be cured. You need a cure, you don't need that superficial growth. Today we see patients using the minoxidil. They use that pump that gives them new growth. It is causing severe side effects because the infection has to be cured first, and as per Ayurveda, if the infection is cured, we see the scalp is clear, and in fact through Ayurveda, new growth is seen through just the medications when the root cause internally is fixed. So if you have the problem coming back again and again, choose Ayurveda, choose wisely. On this channel you will find a number of videos on hair fall, on dandruff, on scalp psoriasis, on seborrheic dermatitis, on the fungal infection of the scalp as well. So make sure you choose Ayurveda, choose wisely, and make sure you choose a treatment where promising results are seen with no reoccurrence, no relapse, and the problem is cured from the root cause. So this was all for now. Any doubts, questions, let us know in the comment section below. Until next time, from Jyovis and the team, look impressive, be progressive.